the last application I'm going to talk about is cardiovascular biology, and those of you who are familiar with visual sonics will know that we've been doing this for years and years and years. So everything from LV analysis for cardiac output, ejection fraction, fractional shortening, those kind of cardiac measurements, looking at blood flow through the mitral valve, tricuspid valve, looking at velocities, blood velocities, and then going as far as looking at strain, both in the heart and in blood vessels. So we have a very, very strong offering when it comes to cardiovascular biology. But what can the Vevo laser, and in particular the Vevo LAZR-X, offer us? This is a really, proof of concept study that was done recently by Kelly O'Connell, one of our application scientists, where she was basically injecting isoproterenol, which is essentially a vaso, I believe it's a vasodilator. Where you can see here, she's drawn a couple, we're looking at a long axis view of the heart here. There's this red region of interest. I'm not sure how clearly you can see it on your screen, but there's a red region of interest which encompasses the left ventricle, the myocardium here. And then you've got other regions which, for example, the skin over here, and just a region in the thoracic area here. So you can see that you get this huge increase, this vasodilation happens upon isoproterenol injection. So you get this huge increase in SO2. Again, this is SO2 maps that we're looking at. Huge increase in oxygen, and then it comes back down to baseline. Whereas you get very little change in the heart muscle itself. And the point I want to make about this, first of all, isoproterenol is used for chronic, they deliver it chronically, or chronic doses of it, in order to induce heart failures. So it's a way of mimicking heart failure injury. And then we can sort of look at that animal over time and see, the sort of ischemic events that may be occurring during heart failure, during MI models, and that kind of thing. But the nice thing about this is that we're actually using a pharmacological manipulation to see different effects in peripheral vasculature versus vasculature which is in the myocardium. This is a different study that was done using a different animal, but in this case phenylephrine was injected, and this is a vasoconstrictor, at least in the peripheral vasculature. And I think you can see here that the loop, again, it's really choppy, it's playing back in a really choppy way, but upon injection here you actually get opposing effects on SO2 levels in what I've called just the ventral chest versus the anterior myocardium. That's the green versus the red regions. So you actually get, upon injection of this this agent, you get this huge increase in SO2 in the anterior myocardium and a big decrease in the ventral wall. And again, I really just want to point out with this that we can actually use pharmacological manipulations and look at differences between the anterior myocardium versus peripheral vasculature. So we can really start to do a little bit more in terms of looking at cardiac function, not just looking at the function of the heart itself, but functional parameters like oxygen saturation, ischemia, metabolism, this kind of thing. So this is really just to sort of pique your interest and be able to sort of think about these applications using something like the Vevo LAZR-X for doing this.